Hello, ladies and gentlemen, and welcome to the official launch of the News with Booze podcast, where we deliver the news with some booze. And given all the hysteria going on in the world today, I thought it was fitting to start this podcast with some Corona. But in all seriousness, let's get to the meat of the segment. Let's get to the news. After all, that's why you're here. Recently, there's been quite a bit of hysteria going on in the world today, especially in the United States. Recently, yesterday actually, I was going to the grocery store. It was the local Meijer, and it was pandemonium, absolute chaos. There were people pushing and shoving each other to get, well, the toiletries. Nobody was touching the food. It was a bit ironic, preparing for doomsday and not getting food. But I feel like everybody's just blowing it wildly out of proportion. It's not going to be as big of a deal as people seem to believe it is. And while I was there was a few instances that I saw that were just over the top. There's one old woman. She was near the checkout line, and she was looking around, confused as all hell, and she looked like she was trying to fight back tears in her eyes. And she looked scared. She looked absolutely scared, and I think it's because of all the media hype. They're overhyping the virus, and it's freaking people out, and it's legitimately scaring them. And, it's okay to be prepared for the worst case scenario. I believe you should be, but you shouldn't be walking around every single day like the worst case scenario is a certainty. It's just not a healthy way of living. And this poor woman. And then there was another instance, the same Meijer, where I saw a woman get shoved out of the way so somebody could grab paper towel. Old woman got shoved out of the way so this man could grab paper towel. He was about my age, too. It was, man, people just need to calm down. But anyway, let's dive into some of these websites I have pulled up. Okay, so for the first thing, I wanted to talk about the symptoms of COVID-19. And for those of you who are listening on the podcast, you can find all this information on the CDC. So the symptoms are just a fever, a cough, and shortness of breath. And the symptoms start to appear 2 to 14 days after exposure. So, and if you go a little bit further down here, it also says bluish lips or face. Okay, so moving on, I'm going to talk about what to do if you happen to be sick or if you're trying to avoid being sick. So the CDC suggests you stay home and avoid public areas, stay away from others, and limit your contact with pets and animals. Now, the reason why they're stressing this point is because animals can be carriers to certain diseases without actually expressing the traits of that disease. And there have been reports that some animals can be carriers of COVID-19. Although I don't have those reports pulled up, so don't quote me on that. If you're sick, you should wear a face mask if you're going out into public areas. If you're a healthy person going into, say, a hospital that has an overwhelming amount of sick people, you should also be wearing a face mask. And this isn't obvious, but if you're sneezing or coughing, you should cover yourself, wash your hands, use sanitizer. And it's just same things you would do to avoid the flu. There's not too much of a difference there. So the next thing I wanted to highlight is the people who are at serious risk of illness from COVID-19. And the CDC says it's older adults, people with heart disease, diabetes, or lung disease. So people with compromised immune systems, and they should be staying at home and trying to avoid contact with crowds as much as they possibly can. And the CDC also suggests that people who have prior health conditions should have supplies on hand and they should just take their normal everyday precautions that they would with the flu. So next, I'm going to pull up some statistics just to give people context, because as I said at the beginning of this segment, there's a lot of people in just total hysteria mode, and it's unwarranted. So this is from PubMed, obviously, um, and what it says here is 43 to 89.3 million people were infected in the United States with the H1N1 swine flu virus. 274,000 of those people were hospitalized, and about 12,500 of them ended up dying. Now, if you look at those statistics, and according to CNN, by the time Obama declared a state of emergency, 20,000 had been hospitalized and 1,000 had died already from it. So, if you compare that to the reaction Trump's had with coronavirus, it's pretty easy to say that his response has largely been preemptive, not so much as a counter to what's going on in the world right now. Because as it stands, looking at the situation report, most recent situation report released by the World Health Organization, only 142,000 globally have been confirmed with the disease, with the vast majority of them in China, and only 62,000 cases outside of China. So, and then you can break it down further with all these other statistics that they got here. Looking for the U.S. So in the United States, you have about 1,700 cases with 414, I think that's confirmed, and about 41 deaths. So drastic change between the two administrations and how they dealt with their viruses. I'd say America is jumping the gun a little bit early to call it a pandemic, considering swine flu touched 60 million, possibly 80 million, and the hysteria was nowhere near the level it is today. And Trump recently, I believe it was last Friday, declared a state of emergency over coronavirus, national emergency. Yeah. So I really do sincerely believe that people just need to calm down. It's been wildly blown out of proportion. And I believe the media is largely to blame. And, the experience that I had at Meyer really highlighted that. And it's kind of why I prematurely rather, decided to launch my podcast, because I had enough of it. I've had enough of Corona. There's so many other things going on in the world that we could be talking about. And the hysteria with this, it's getting to a point where, civilized society is going to break down. I truly believe that. And it's not because of the virus, it's because of the public unrest. And, people are terrified. They're scared. They're really scared. And all you need to do is limit your contact with the outside world if you're sick. Try to stay away from super crowded areas, and you'll be fine. Last thing I want to say is I'm sorry for the video quality. Like I said, this was a bit premature. I technically wasn't supposed to start until May, after we had all the equipment. It's still coming in. We still have equipment coming in, so it'll get better. I promise it'll get better. And I do have a partner who's going to be coming in and doing this show with me, so it'll be a bit more entertaining. It'll be longer. He and I are shooting for about a 2-hour podcast every week. So once we have the groundwork laid, should get going pretty good. Currently, we have a Twitter that we're getting up and running. We also have a Patreon, but that's not completed yet. We also have a website, but all these things are slowly being worked into motion. So I'll keep you all posted on that, and I will submit the links once they're ready. But in the meantime, like and subscribe. It is YouTube. Hit that notification bell because I guess the YouTube overlords don't really care about subscriptions anymore from what I've seen and heard, Adpocalypse and whatnot. And, everybody just stay safe.